Hello bellspalsyers. So today I would like to talk to you about the reason why your muscle can heal at a different rate when you have Bell's palsy. So please know first that for most of you, you will have a spontaneous recovery within the first 3 months with hopefully no symptoms. For others, you will have a good recovery for the first 3 months, but with potential mild symptoms that will continue on for a while. And for a more rare, hopefully, pack of you, it will be things that will persist much beyond the 3 months. And also know that generally the facial nerve heals. Most of the healing occur within the first year. So if you are about the year mark and you haven't consulted with any neurologist, otolaryngologist, facial physical therapist, or facial specialist, you need to do this ASAP in order to potentially have hope to get function back in your face. So the facial nerve innervates 5 different regions in your face. It goes to your brow, to your eye, to your cheek, to your chin, and your neck. So there's 5 branches, and within those 5 branches, this is also the reason why muscles heal at a different rate, because they are all innervated by a specific branch, and all of these branches can heal at a very various rate. So you could have one branch that heals really much faster than the others, and you're gonna recover function much more rapidly in the muscles innervated by that branch, versus others that will take much longer. So there is a multitude, a lot and lots of possible scenario that can present here. Note that the facial nerve heals at a rate of 1 millimeter per day at best. And so within those 5 branches, you could see how there could be some differences of healing rate, and that is something to consider. And of course, we're talking about Bell's palsy here. We're not talking about a facial paralysis caused by an accident or trauma to the facial nerve, like a partial or a full severance of the nerve. This would be a very complete different scenario. With a prognosis that is going to be much poorer in general. So with Bell's palsy, the type of nerve injury is called neuropraxia, and generally neuropraxia happens when the nerve is either not receiving enough blood flow, so that is called ischemia, or that the nerve is compressed, and generally that happened with the compression of the facial nerve, where it emerged right close to your ear, that little hole that comes from the brainstem, and your nerve will swell and be compressed in that canal that is very narrow, and where there is no extra room for that nerve to go. So that will result in the facial paralysis from being compressed, and the information being carried to the nerve being interrupted. Another thing to consider is that will make the healing of the nerve variable is again, so the blood flow to available to that nerve, to each branches of the facial nerve, the amount of compression. So for example, if you just started having symptoms when it's fresh, within the first 48 hours, you're gonna have a certain amount of compression. If you are getting treated and getting steroids right away, which is an anti-inflammatory, it will decrease that compression early on. Now, if you go more than a few days before getting treated, that compression has been going on for longer. So there is a longer nerve injury that is being caused to the nerve. So that is something to consider, and this is why the proactivity here, and really just not having this treated as early as possible, like all nerve injury, is critical, I believe. The last thing I want to talk about is the other thing that depends on the nerve healing is also the level of fibrosis and scarring around each parts of each branches of the nerve. So if the longer it's been going on, and if you haven't really had any facial massage, any stretching, and your face has been paralyzed for a longer period of time, your body's going to create fibrosis, and that will prevent the nerve from moving correctly, and that will also delay the healing. So I hope that answers at least partially the question of why certain muscles could heal faster than others when you have Bell's palsy. And please leave me a comment, DM me for further questions, and I hope you're having a great day and a good Thanksgiving week. Bye-bye.